George.
Good, how are you?
Good to meet you. My name is Marvin. I'll be your nurse tonight.
Nice to meet you.
And I'm going to do an assessment on you. Actually, we're going to look at your skin, your neck, your head, your heart, and your peripheral areas.
Oh,
so,
perfect.
before I do that, I'll have to collect some data, some subjective data.
Okay.
So, at this
Right.
point, I'll ask you a few questions. Okay? What's your date of birth?
Oh, July 28, 76.
And it's George Umasum.
George, yeah?
Okay. Have you had any head surgery?
Nope.
Any recent headaches?
Nope.
Any dizziness?
No.
Any
None.
history of seizures?
None.
No neck pain?
Nothing.
Any numbness in the arms or legs?
No.
Any history of heart disease?
No.
Any family history?
No.
Okay. Any history of high blood pressure?
None.
Any sores in the leg?
No.
Are you diabetic?
No.
Are you on any medications?
None.
Okay. Alright, thank you. I'll just step out a little bit. I'm going to wash my hands, and I want you to just take your shirt off, and you can sit, and I'll come back and
Okay.
start the assessment.
Thank
So
you.
I'll wash my hands and come back.
Thank you. Yes.
Okay, Mr. George, I'm back. I've washed my hands, and I'm going to begin that assessment. But first of all, let me take a blood pressure for you before we begin. Okay, so you said you had no history of high blood pressure, right?
None.
Okay. Sorry. If it tightens up a little bit, but it's okay. 120 over 60 and heart rate of 75. That's very good. Alright, my gloves on. I'm gonna start with your head. Okay, I'm just gonna look at your head real quick. Okay, I'm assessing the head. It's of normal shape, normal size. There's no lice, scab or moist. I'll palpate for smoothness and symmetry. Scalp feel pretty much smooth. There's no sores. And you said you have no history of headache, Mr. George?
None.
No headaches, you said?
No.
Okay. This time I'll proceed to palpate the head. No tenderness. I'll look at some of the areas, like the mastoid area. There should be no pain. Do you have any pain in the mastoid area, Mr.?
No.
No pain?
No.
Okay. The temporal area, there's no pain. Just open your mouth, close. Temporal muscle is, joint is equal bilateral. There's no swelling to the submandibular glands. No swelling to the supramandibular nodes. Color of the neck is okay. Pink and dry. We proceed to do some range of motion of the neck. Could you put your neck to the chin? Good. Backwards. Great. Side. Next side. Can you turn your neck a little for me like that? And next side. Okay, with your neck turn, can you put the shoulder up, shove it up? Good. Next one. Muscle strength is equal bilateral. There's no swelling to the thyroid glands. The trachea is midline, no tracheal shift. Palpate the thyroid glands. There's no pain, Mr. Is there any pain, Mr.?
No.
Okay. Posteriorly, I'll palpate. Is there any pain?
None.
Equal bilateral. The jugular vein, there is no distension, there is no pulsation. Actually, pulsation of the jugular vein disappear at a degree of 45 degrees. So Mr. George is in a sitting position. It's normal if there is no pulsation of the jugular vein. The chest wall is symmetry. There is no scarring. There is no bruising. Mr. George said he's not on any medication. For people who are like on Coumadin and other blood thinners, you will really assess them for bruising. Posterior is okay. There is no bruising. There is no scar. There is no rash. There is no swelling. The skin is warm, dry. So far intact. No swelling to the hands bilaterally. I'll assess your radial pulses. They're equal, about 3+ bilateral. Ulnar pulses, equal bilateral. Capillary fill, less than 3 seconds. Open your arm for me and close. Okay. Very good, Mr. George. Things looking okay. I'll proceed by doing your cardiac assessment. There is no history of heart surgery, right?
No.
You said there was no hypertension,
No.
your blood pressure was okay. You're not on any medication, which is good. The chest wall is symmetrical. There's no barring chest. There's no barrel chest. There is no pigeon chest. At this time, I will palpate to see the border of the heart. There is no crepitus. There is no pain. There is no swelling. Any pain, Mr. George?
No.
No. That's good. Now percuss the heart border. There is dullness over the border of the heart. And I will assess for the apical pulse. It is in the 5th intercostal space, mid-clavicular line, left mid-clavicular line. There we find the apical pulse. I'm going to listen to heart sounds. First of all, I listen to the pulmonic area, then the aortic area, then I go down to the tricuspid area, and the apic area where we can listen to the apic pulse. I'll ask you to lay down, Mr. George, so I can better assess that apical pulse. turn to the left side a little bit. And still, fifth intercostal space, left mid-clavicular line. You can also use the bell to listen for heart sounds. Can you hold your breath a little, Mr. George? Take a deep breath and exhale and hold it. Ask the patient to do that, and you will not, the breath sound will not, interfere with the heart sound, so you can better able to assess your heart sounds. Thank you, Mr. John. So far, the skin of the abdomen is okay. No bruising, no swelling, no pain of the abdomen, no pain, Mr. George?
No.
That's great. The legs are okay. No, there's no scarring, there's no wounds, there's no scaling of the legs. I've assessed the popliteal pulse. They're equal bilateral. No edema to the legs, bilateral. I'll also assess the posterior pulses. Post-tibial pulses, they are about 3+ bilateral, and the pedial pulses also 3+ bilateral. Capillary refill to the lower extremities is less than 3 seconds. At this point, Mr. George, everything pretty much okay.
Thank you.
I thank you for allowing me to do the assessment, and I hope that everything will go well with you.
Thank you.
When completed an assessment of your patient, abnormal spinning should be documented correctly, and the patient should be referred to the physician.